Hello and good day. I'm Dr. Stephen Jella, the Associate Executive Director of San Diego Youth Services. My role is to oversee all the programming and clinical activity of the agency. Thank you for the time you're taking to hear me describe the creative and innovative programs San Diego Youth Services offers to youth that help them advance health and wellness. Our mission is to help at-risk youth and their families become self-sufficient and reach their highest potential. We do whatever it takes to engage, determine needs for recovery, and respond using innovative approaches that are based on individual needs and progress to support our clientele to a path to wellness and resilience. Our San Diego Youth Services youth range in ages 0 to 25. They are often from low income, culturally diverse, and face multiple factors that place them at risk for health and social problems that without support face chronic lifelong difficulties. San Diego Youth Services programs are critical in our agencies and the regional community's continuum of services. Placing a youth in a shelter and/or an effective transitional living program is considerably more cost effective than supporting the highly probable negative costs of crisis care, homelessness, unemployment, court costs, and eventually welfare and prison costs. As an alternative, youth can receive shelter care combined with comprehensive services in programs like our emergency shelter at a fraction of that cost, with the increased quality of program services. San Diego Youth Services operates over 30 programs at 13 locations in San Diego County, including the following: group home program for deaf foster youth, support for adoptive families, alcohol and drug treatment for chronic juvenile offenders, mental health services for runaway and homeless youth. We provide preventative mental health for elementary school age children, foster care, interventions for teen girls who are victims of commercial sexual exploitation, emergency shelter for homeless teens, safe housing and supportive services for homeless transition age youth, programs designed to reduce teen pregnancy and STDs in identified high-risk communities. Let me tell you about something that happened just the other day. I was supporting a therapist with her client, Jamie. 16-year-old Jamie turned to the streets several years ago because of his home was unsafe due to continuous violence and abuse from his father. However, Jamie found out quickly that the streets were no haven and unsafe as well. As Jamie's mental health deteriorated and became a victim of exploitation, his life situation was becoming more desperate. Fortunately, he found refuge in San Diego Services Emergency Youth Shelter, where he was immediately referred to an SDYS therapist to help him deal with his trauma and stabilize his mental health condition. Jamie also received a medical screening, provided food, clothing, temporary safe shelter, and was re-enrolled in school, and more importantly, was able to leave life on the streets and escape from their exploitation. Jamie's future seems brighter as he will soon be transitioning to one of San Diego Youth Services foster homes, where he will have a safe home and a loving family. Because of the continuum of services offered, San Diego Youth Services has become a gateway to Jamie's recovery and reintegration in society. Thank you for your time and consideration. Good day.